For some reason, you've had a C-section or you are planning to go ahead and have a C-section. So then the question will arise, how difficult is it going to be for me to heal after giving birth? Will I be able to take care of my baby? How much pain will I be experiencing? How do I take care of my stitches to heal better? So these are some very common questions that a mother has after a C-section. So let me quickly answer all these questions for you, and I will tell you how to make your recovery after C-section very easy. Okay, so stay tuned till the end of this video. Hi, I'm Saranya, the founder of Babypedia. I'm a pregnancy coach and a life coach for mothers. So now let us look at healing after a C-section. Okay, so yes, if you have been given a spinal anesthesia, an epidural, which will be given to your lower spine, and you will feel numbness in your lower part of your body. Okay, from maybe your chest below, you will start to feel numb. You will not feel anything. The spinal anesthesia is what is being recommended and followed for most of the C-section surgeries nowadays. But sometimes if you have any medical complications, your doctor, your anesthetist may go ahead and give you general anesthesia. So with general anesthesia, you will be totally out. You will not know what is happening, and you will wake up after a few hours after your surgery is over. Okay, so whatever type of anesthesia you have been given, let's say if you had a spinal anesthesia, what happens is you will know what is happening during the birth process. Okay, you will be able to feel the pressure that the doctor is putting on your stomach when they're pulling the baby out, and then when the doctor is touching you and stitching you, you will feel it as pressure, like how when you press your skin, but you will not be able to feel the pain. So since you are awake, as soon as your baby is born, you may hear your baby cry, you may see your baby immediately if you request your doctor to. So you will know what is happening throughout your birth process. So once you know all the stitching is done, and then the doctor has ensured that you are recovering well without any complications, a couple of hours after that, you will slowly start to regain sensation in your lower body. If you are given general anesthesia, then you may slowly wake up a couple of hours post-surgery. Okay, so whatever it is, once you get to be with your baby, the first thing that you would have to do, which is recommended by WHO, ACOG and many organizations, is try to give skin to skin with your baby. So skin to skin is essentially where you remove your top, you put your baby without any clothes onto your bare chest. Your baby's skin is against your skin. Your baby slowly, when you put your baby to your chest, your baby slowly smells you, they feel you, and then they hear your heartbeat. Remember, that is what your baby has been hearing from the minute that your baby was formed, right? So baby starts to listen to your heartbeat. Your baby immediately understands that you are there. So your baby starts to relax, your baby starts to feel safe, and your baby starts to connect with you. Okay, and breastfeed immediately after that. Yes, I know you're wondering, how do you expect me to get up and sit and breastfeed after a major abdominal surgery? No, you do not have to get up and sit. Okay, you just have to put your baby onto your breast. Your baby can be lying down, on the tummy on top of you. You just have to position your baby in such a way that your baby latches onto your breast and your baby is able to start suckling. You also can get the assistance of the medical team, the nurses who are there. They will come and they will definitely support you. If there is a lactation professional in the hospital, they are the best person to come support you to be able to breastfeed your baby. Why am I asking you to breastfeed in all this pain? Because once you do that, the bonding between you and your baby increases, and your baby will also be able to breastfeed better. It also kickstarts all the hormonal changes that are needed in your body. And again, one question is, can I breastfeed soon after a C-section? Because we hear so many people say that immediately after C-section, your hormones are not on point, you've not delivered your baby vaginally, so you will not be able to breastfeed, your milk has not yet come in. No, all that is totally false. Okay, if you have crossed 12 weeks of your pregnancy, your breasts are already preparing milk, they're already producing enough milk and it's stored inside, it becomes very thick and it is called colostrum. So whichever week you deliver, even if your baby is a preterm baby, whether you deliver vaginally or through a C-section, all you have to do is touch your baby, look at your baby, feel that love, and put your baby to the breast. And as your baby suckles, this colostrum will start to flow. And in the first few days, as your baby breastfeeds more and more, the colostrum will get emptied and mature milk will start to flow. Okay, so try to breastfeed, because that is going to kickstart your recovery as well, because all the hormones are getting into place. Next, if you have a lot of pain, please do ask for painkillers. The main aim here is for you to be as comfortable as possible, because if you have a lot of pain and a lot of discomfort, you will not be able to do the next things that I'm going to tell you. You will not be able to bond with your baby. You will not be able to, breastfeed your baby. You will also not be able to walk as soon as possible. Yes, you heard me right. You will have to walk as soon as you can. Once the doctor gives you the clearance, especially because you've had a spinal anesthesia, your doctor will confirm that you've gotten full control of your legs, and then slowly, with the support of somebody, it is recommended that you get up and you start walking. I'm not going to ask you to walk the whole length of the corridor in the hospital, but at least 10 steps inside your room. It will be difficult. Okay, I am accepting. I have had 2 C-sections. It will be difficult, but walking as soon as you can has its own set of advantages. It is going to reduce the chances that you will get postpartum complications or post-surgery complications like a blood clot. It will kickstart proper blood flow in your body, which will also activate your healing. Your pain will also reduce once you start using all your muscles. Okay, so please try not to hunch over, hold yourself straight, and walk as slowly as you can, but at least 10 steps at a time. And once you are comfortable doing that, every time you are going to breastfeed your baby, get up, walk for 10 steps, or increase it as you feel comfortable, and then come sit, breastfeed your baby, then again walk after the feed, and then lie down. Okay, because walking gives you a lot of benefits. The next thing that you will have to do after walking is walking will also help to relieve a lot of gas that is formed during surgery. So you may feel very bloated. So when you start walking, you will pass gas. It will make it easy for you to also have a bowel movement and kickstart digestion for you. Now that we're talking about digestion, you can have food. You need to have food to recover. But start with home cooked, easy to digest food. It can be soups, it can be vegetable broths, it can be very simple carbohydrates. Ensure that you're also having fiber-rich food too, so that you are not getting constipated after your surgery. Okay, that is also very important. So start with very simple foods, how much ever you're able to eat, even if it's just a few mouths, that's okay. And then slowly increase the amount of food. Remember, you need to have nutritious food to be able to heal. You need to take in a lot of proteins as you are healing, so that your muscles and the C-section scar heals better. And you should ensure that you're getting all the nutrients you need, so that all that you lost during pregnancy, all that your baby has taken is getting replenished, so that you can breastfeed your baby well as well. Okay, and then let's say 1 or 2 days, based on your healing, your doctor may remove the band-aid that is on top of your C-section scar. And after that onwards, once your doctor has given you the clearance, please ensure that you keep your C-section scar very clean, okay? Because it is normal to have a fold of your tummy hanging over. So this is your body, this is the C-section scar, a little bit of your tummy, that overhang belly is normal, okay? Because it took 9 months for your tummy to become so big. So it is going to take some more months for your tummy to go back in. Please do not worry about it. Now is the time to think about your healing and recovery, taking care of your baby. You still can start out, reducing your tummy after a few months, okay? So because it is hanging, you can experience some pain, and a lot of sweat and dirt can get collected, okay? So always take a clean cotton cloth or a cotton swab, dip it in warm water or saline water, whatever your doctor recommends, and just gently run it over your C-section scar a couple of times till it becomes clean, okay? And then hold your tummy for some time, let it air dry. And after that, if your doctor has given you any medicines like, betadine solutions or powders or ointments, you can apply. In case your doctor has not given you anything, that is also good. So let it air dry, then apply the medicines, and, you can let it heal. Also, you need to ensure that you're cleaning at least twice a day. Okay, once in the morning and once in the evening or night before you go to bed. It is very essential. So keep the scar clean, keep it as dry as possible, clean it twice a day. All these are things. In case you see any type of bleeding, any type of pus that is oozing out from your C-section scar, then you will need to go check with your doctor. Okay, in case there's a mild infection, or 1 or 2 stitches are not done, is becoming loose, anything, okay, could be hurting. So if you see any type of liquid oozing out like blood or pus, please go meet up with your doctor, okay? So these are generally the instructions to recover after C-section. And yes, the final very big question, when can I start exercising? So around 15 days, when you're feeling much better, you can do mild walking, that is inside the house. You're walking till the dining table, you're sitting, you're having your meals, you're coming back, feeling okay. So you're putting your baby onto you and you're walking very slowly inside the house. Yes. 1 month you can start walking slowly outside. 45 days you're feeling a little better, you can start walking. So walking is going to be the only type of exercise you're doing till at least 2 to 3 months. Okay. After you know that your scar has healed very well, you do not feel any type of discomfort from your scar, then after that what you can do is you can start with slow exercises. Okay. There are basic exercises to prepare. Your physiotherapist will be able to help you with that, or any postnatal exercise expert will be able to help you with that. So start doing the basics on your bed. If you don't feel any discomfort slowly, then you can keep progressing until you get back to your normal workout. Okay. So remember, a C-section again is a major abdominal surgery. It can take your body a lot of time to recover. So please give your body some time. Okay. Just imagine somebody in your family has had a major heart surgery, or their body was opened, they had a major abdominal surgery. Would you be asking them to get up and be back to normal within a few days? No, right? But after a C-section, you will have to get up and you will have to walk around within the next day, along with taking care of a teeny tiny baby. You're breastfeeding your baby, though there are other people to help you take care, to put the baby to sleep. Ultimately, in the end of the day, your baby needs you, right? So give yourself a lot of love. Self-love is very important. Give yourself a lot of time to recover, and then slowly, within a matter of a few minutes, you will start to feel better. You will start to understand that you have healed. Okay. So happy healing after a C-section. Take care, and I will see you soon in another interesting video. Till then, bye bye.